Hello, hello, hello. Your girl is back as I said I would be for part two in this 4 to 5 part series. So I said, let me slide back through and give them another update on this. Number two, shout out to the notification gang. I see y'all. Love y'all. It's your girl, She Nurses TV. I nurse. It's really what I do. And I'm going to bring y'all that tea too, okay? So be on the lookout for further videos. Like, share, subscribe, comment, all of that. So we can keep each other entertained. Now, if you hear that, it's probably a train, okay? Now, what I'm talking about here is RaDonda Vaught. RaDonda Vaught is an RN that was accused of giving one of her patients, a 75-year-old female patient, the wrong medication. The patient was scheduled for a test in an MRI-like type of machine. And the only reason I could think of her giving her Versed was the fact that the patient may have complained of anxiety before going in. You know, it's a small space. You go really, really slow. You have to lie really, really still so that they can get their images. And the only thing I can think of is that the patient must have complained about being anxious about that. So what happened? Instead of giving her patient the ordered Versed, which is a sedative, it's a relaxant, it's something that's going to keep her calm through the whole procedure, and probably 2-3 hours after that, she would have a good nap. She didn't give her that. She gave her Vaccuronium, which is a paralytic. It's a paralyzing medication. The only time I've seen Vaccuronium given is in the intensive care unit. It's in the ICU. I have never seen that given anywhere else. That's not saying that it hasn't been used anywhere else in the healthcare field. I'm not saying that at all. I'm just relaying on my personal experience, okay? And we use it on vent patients, patients that are intubated. When they're intubated, they cannot talk. We need them to relax. We need them to lie really still. Okay? So the more you move, the longer you're going to be in there, and because they're going to have to work against you wiggling, and they're trying to capture these pictures, internal pictures for the doctor. Okay? So that's how that works. And even when you take Vaccuronium, there's a protocol for that. There's even a little device that we have to use. It's a nerve conducting device, okay? And it's like a four-way thing. It's four different. Let me see. I'm trying to think how to best describe it in layman's terms. Okay, it's graded on a 4-point scale. You're either going to get a grade 1, 2, 3, or 4. But all of those impulses from 1 to 4 is what we're checking to see how paralyzed you actually are. So if we put this nerve conductor on your wrist, on the inside of your wrist, and you only give 1 twitch, then that's a grade. If you give 2 twitches, that's another grade. The doctor's usually like 1 or 2, only 1 twitch when you put it down, or 2 twitches. But the higher the twitches, the more awake the patient is. I want you guys to keep that in mind. So most doctors like it to be at 2. That's adequate enough for them to know that their patient is sedated, they're not hurting, they're not in any pain, they're relaxed, and there won't be any issues. And you'll be able to stop that at any time, and the patient starts waking up. So can you imagine someone giving you, you're alert, you're oriented meaning you're able to say where you are, why you're there, state your name and your date of birth perfectly, and all of a sudden you lose control of that. Your muscles are paralyzed. You can't even say, "Hey, I'm breathing a lot slower. Something's going on with me. Hey, I can't move my leg. I can't move my hand. I can't even push my call button to ask you for help." Can you just imagine that for a second? Just imagine that, okay? So that is where we're getting to the meat and potatoes of this. So she was given the wrong medications. And in part 2, I want to talk about some little helpful protocols that were put in place to help us to not make medication errors, okay? And one of them is called the 10 Rights of Drug Administration. It's the 10 rights for us nurses to follow in order not to make a medication error, in order not to give somebody something they're not supposed to have. You have your medication administration record. So you have that there. You're able to look at all the medications that this patient is taking. You can physically have the medication in your hand and you can cross-reference each and every single medication. Once you ask the patient, hey, what's your first and last name? And they're able to tell you, what's your date of birth? And they're able to tell you, we have to have at least 2 patient identifiers, okay? And those are 2. And you can look on their armband and see that first name and last name matches your medication administration record, and that date of birth is spot on. Okay, so let's go over the 10 rights of medication. Let's go over some things. We have to have the right drug. And right now we already know we messed up because we didn't have the right drug. That could have stopped us right there. Because even though that patient didn't have a medication administration record yet, and I'm going to abbreviate that and say MAR. We call it a MAR, okay? Even though the name of that medication was not on the MAR yet because it was a new order, right now we're just looking at the physician's sloppy or not so sloppy handwriting, and we're making out what they want your patient to have right then and there before they go get that test, because they really need that test, right? Okay, so we're looking at our order and we're going to pull out the medication and we're going to have that medication in our hand and we're going to look at that drug that the physician wrote down and we're going to make sure it matches. That could have stopped right there because you could have cross-referenced it one more time before you mixed it and walked in that room. Okay, second right is the right patient. Do you have the right patient? She had the right patient, yeah? She did. Right dose. The doctor doesn't want you giving 4 milligrams and the medication you pulled out was 1 milligram. That right there, we could have stopped right there if it wasn't the right dose. The right route. Route means how we're going to administer that medication. Are we giving it by mouth? Are we pushing it through their IV slowly? Are we putting it under their tongue? Are we putting it in their cheek? Is it something we're spraying up their nose? You have to have the right route available. The route on your MAR has to match the route that you pulled out of that machine, out of the medication machine, which we call Pyxis, Omnicell, whatever your facility calls it. Next is the right time and frequency. Am I giving this at the right time? He probably said now or stat, so the time would be right now. Frequency, if he decides to order that medication in the future, let's say 6 a.m. and 6 p.m., the frequency between the hours between those 2 times is 12 hours. Frequency is 12 hours or twice a day. Right documentation. Now, if this is your first time giving that med to that patient, you're going to document that you gave it, what time you gave it, how the patient responded. Well, we'll get into that because that's on further down in the rights. But you're going to document you gave it, and you're going to document how the patient was before you gave it, because you're going to go back and document it how they were after you gave it in about 30 minutes or an hour or so. And even better, if they're going for a test in the next 10, 15 minutes, you'll go back and make sure they're doing okay. Right history and assessment. You're going to take their history. You're going to be like, hey, have you had this medication before? Have you had any kind of sedatives before to kind of relax you before a procedure? And they'll tell you yes or no. And you'll actually be looking to make sure they don't have, because drugs can interact with each other too. So you got to make sure what you're giving her is not interacting with anything that's already in her system. You're going to take the right assessment. You're going to assess them to see if they've had an allergic reaction to any medication, any sedatives before. And Versed falls under the benzodiazepines, I do believe. I'll put the correct information on the screen. But Versed falls under benzodiazepines. Hey, have you had a reaction to benzodiazepines before? If so, okay, how severe was it? I mean, you're going to really ask, and so you don't make a mistake. You're covering the patient and you are covering yourself, okay? This is important, guys, because of things like this. You don't want to kill somebody by mistake. I can't imagine killing somebody by mistake like that. Oh my God. Can't imagine killing any patient, period. It's just, I would never live that down. Just how hard I'd be on myself. My goodness. They have so much set in place for us not to make a mistake. So, the right drug, and I've already mentioned that. So, we got the right drug. And the patients have the right to refuse. They can say, I ain't had that before. I don't think I need that. I'm not taking that. Go give me a Xanax or something. They have the right to refuse. We cannot force them to do anything or take anything. Honey, they can choose to cooperate in their care or not. Hey, how better do you want to be, or how worse do you want to get? That's how I see it. And I'm like, okay. And I've mentioned this before. You have the right. You have that right. It's under your rights, your 10 rights of administration. Drug to drug interaction. I've talked about that. Drug evaluation. Now, that's the second half of that documentation I was talking about. The right documentation, because you're going to now put how they responded to that medication, okay? The right evaluation. How did they respond? Did they do well? Did they have any complaints, any issues at all? You're going to evaluate that. And you're going to document it, because should they go anywhere else, they go on a vacation or honeymoon and stuff, they need to have that on their medication, on their history, okay? Right education and information is my last one I wanted to cover. Right education meaning you're going to tell them how this drug is going to affect them, what they should be feeling. And you're going to also talk to them about what they should not be feeling, okay? So you're going to let them know, hey, this is what it's supposed to do, but here's some side effects that may occur, and it's really not, and you just tell them how severe it is. You're going to talk to them about how severe it is. Now, that's the 10 rights of drug administration that they have set in place. Now, I want to go over when she got into the system, okay? Now, the head pharmacist is the one who put all of those blockages in the system for us. It'll be like, hey, are you sure you want to pull this? This is a high-risk medication. Do you have the right patient? Do you have an order for this? This needs a 2-nurse verification. You literally have to go and find a second nurse to override the system with you. They literally put in their password and their password, their username and their password. Like, I've had the thing trigger, like I said, up to 4 times on me. Like, are you sure? And sometimes I can get to that third one and I'm like, oh my God, this is not the right medication. Let me just stop right here, okay? So that's put in place. I just wanted to cover the medication part of it and how she could have made this mistake. You know what I mean? But once again, what I want to know, is this a system failure? Is this a nurse failure? Is it both? Should the pharmacist have been punished? Should the nurse that overrode this with her have been punished? Who is it, her to blame? Should they have put the ball all on her? I mean, you got to understand, at the end of the day, the doctor that wrote the order, the pharmacist that monitors the system, they're going to be out for self. You know what I'm saying? Do you think they're going to jump in under the bus and take blame for that? They're going to say, hey, we put the warnings up there. And the doctor can say, hey, she's supposed to verify that and make sure it's the right medication. That's part of her learning. So you guys, let's jump down below, get in this conversation and tell me what you think about this. And I will come back with part 3, like I said, later tonight or tomorrow, part 3. And we're going to cover another part of this because I'm breaking this all the way down, okay? Even down to the guilty verdict, all right? Shout out to my notification gang. Love y'all, and I will talk to y'all later. Bye.